was 4 when she was diagnosed with her brain tumors.
She had 3 to 6 months to live. Camden had a very, very particular mutation in her tumors. Dr. Giles Robinson at St. Jude Children's Research Hospital said for the first time in human history, they thought that they might have a medicine that could help with exactly what she had. A test came back. Our head oncologist was pretty surprised. He used the word miracle. There are countless people with stories just like ours. We would ask and be very grateful for the support and advocacy and funding going forward.
I had a less than 10% chance of surviving. At that point, when my physician and I started talking about clinical trials, I was all in. I have been cancer-free for 4.5 years. I was at the right intersection at the right time of the clinical trial, its availability at Dana-Farber with an oncologist that does research.
At the end of the 1990s, I trained as a medical oncologist. At that time, most patients were treated with either surgery, radiation therapy, or chemotherapy. That made progress and cured some patients, but the great majority of patients with metastatic cancers did not have curative treatment options. That has all been revolutionized by the application of science into cancer treatment.
It starts back in 2005. I noticed a lump in my neck, and it turned out to be non-Hodgkin's lymphoma. I lost about 40 pounds. I was very sick. I spent 18 to 19 hours a day in bed, and with so little hope on the horizon, we decided to ask our kids to come home and have the chance to say goodbye. And it was in the spring of 2011, ipilimumab was released by the FDA. A few weeks later began treatments. Just around the second dose, something changed. The amount of fluid we could take off to the lungs every day started going down for the first time. A week and a half later, I'm getting better. I'm not going to die. It's now been 9 years, and there's no sign of disease.
The COVID-19 pandemic has had an obvious large impact on all fields of life, including cancer research. Cancer did not disappear during this time. Patients with cancer needed to be treated.
The impact of the coronavirus is that having to do video calls with my oncologist so I wouldn't have to go in.
I have had my medication sent by courier to me. It hasn't been too tough, so I'm very thankful.
At this time, it's of particular importance to advocate for funding cancer research. The AACR has advocated to get the stimulus support for the National Institute of Health and for the National Cancer Institute.
There's nothing more important than for Congress to continue to fund to the greatest extent possible all of these efforts, because so many strides have been made. I myself have gone through 5 different cancers.
I would like to say to Congress that if we're to be the country that we would like to be, then find the funds to do the research.
Having a cancer diagnosis is devastating. The first thing I thought about was, what will happen to my daughter? She was 7.5 at the time. If there was more research and we could save more lives, I think it would make a significant impact on not just the families who are directly affected, but Americans and society as a whole.
The AACR has been capturing the most important advances on cancer diagnosis, research, and treatment. The investment in science reverts into benefit for patients.